All right, guys, today we're going to be talking about Lyme disease and its symptom profile and a bunch of other scientific jargon that I'll be discussing involving treating it and basically how it works in the human body. Okay. So first, we're going to talk about the origin of Lyme disease, right? So really, the name of this bacteria is Borrelia burgdorferi, right? And it was first discovered in Lyme, Connecticut when there was a massive outbreak, right? So that's why it's called Lyme disease, but it's really borreliosis, okay? And there's an entirely different form, or I shouldn't say a different form, a more advanced stage of the disease called Neuroborreliosis, and that's when it gets into your central nervous system, and that's when it gets very, very complicated and also I'll say scary and dangerous and unpredictable, and it's just not a very good time. Okay, so I want to get this point across that it's a very, very complex illness, like so complex that even the best doctors today still aren't fully sure of everything it can do. And it's a really interesting pathogen because it can be dormant in a large amount of people. Like, they can have the bacteria in them, not express any symptoms, not be sick from it, be totally okay, and that's because their immune system is strong enough to kind of keep it at bay, right? So I'm sure you've heard about the typical diagnostic criteria. The first thing would be, say you get bitten by a tick and you get this really bizarre rash that looks like a bullseye, right? And of course, if your skin is lighter, it's going to be easier to see it on because it's red. So I'm white, so it's going to be like a little red around the bite, then a ring of white, then another ring of red, okay? And that's going to be, it'll start small and it'll just start expanding, right, as the bacteria spreads out. And that rash is your immune system mounting a response to this bacteria. Now, some people don't get this rash, which kind of means that their immune system isn't going after and attacking it, right? So if you don't get that rash, and you never see the tick because they're about the size of a poppy seed, you might not ever know that anything's wrong until a while down the road, and when you get really, really sick. So getting that rash is a great sign first, because it means your immune system's trying to do something, but also it cues you into this, oh, I have this. It's called erythema migrans. That's what the rash is called. If you see that rash, that is a 100% guarantee you have Lyme disease. If you see that rash, you have Lyme disease. It does not matter if you go get tested or anything. That rash is proof that you have Lyme disease. That is the only way you'll get that rash, okay? So if that shows up, that's great. You can go to the doctor. You can get treated with the standard 4 weeks of antibiotics. I personally think you need much more, and so does everybody in the space, basically. But your GP will say, okay, here's a month of doxycycline, right? And that will actually do the trick for a lot of people, and they'll be fine after that. So that's another key part of this disease is early treatment, okay? If you are able to catch this and treat it early, you have a very good chance of beating it. Never have to worry about it again, ever, right? Unless you get bit again. So that's really important. So I'm gonna cite a study they did on some farmers out of Wyoming. It was either Wisconsin or Wyoming, one of the two, where a large percent of them actually had that. They tested positive for it. They had Lyme disease, but their immune system was so robust and they were in such, it was functioning so well and efficiently that they were fine. Their immune system just kept it in check, that's the job of the immune system. So they never had to worry about it, and they were unaware they even had it. All right, so now I'm going to read to you guys the Horowitz symptom list for Lyme disease, and these are just many of the basic symptoms that you'll get that you will probably be dealing with if you're dealing with this illness. A lot of these, only maybe a few of these have to do with the neuropsychiatric presentation. Most of these are just the regular presentation of borreliosis. So I'm just going to read this list. Dr. Horowitz is very, very good in the area of Lyme disease and other tick-borne illnesses. So he's got 38 items on here, and I'm just going to go down the list. So we got unexplained fevers, sweats, chills, or flushing, unexplained weight change, loss or gain, fatigue, tiredness, unexplained hair loss, swollen glands. So that's going to be like in your neck, under your armpits. There's several areas in your body where your lymph nodes are. That's what he means by glands. Sore throat, testicular pain or pelvic pain, unexplained menstrual irregularity, unexplained breast milk production or breast pain, irritable bladder or bladder dysfunction, sexual dysfunction or loss of libido, upset stomach, change in bowel function, that would be constipation or diarrhea, chest pain or rib soreness. I had this bad. My entire chest and ribs were it was so painful when I initially got sick that I was just convinced I was going to die. Like I really thought I was. I couldn't explain it. I had no idea about any of this stuff. I was convinced, oh my gosh, I must have like cancer growing all over my chest, and it's creating all this pain. So went to the doctor very soon after a little bit of that. Shortness of breath or coughing, heart palpitations, like your pulse could skip, or like it says heart block. I'm not sure what that means. I hope that doesn't mean heart attack. But a heart attack is something that can happen from this. History of heart murmur or valve prolapse, joint pain or swelling. This is going to be a major one for a lot of people and how they'll first know they have it. So fatigue is going to be big, and then a lot of people will get joint pain or swelling, and they'll get like their joints will literally swell up and become like arthritic, and they'll be like 20. So they shouldn't have arthritis, right? That's for old people, for the most part. For the most part, guys. Stiffness of the neck or back, muscle pain or cramps, twitching of the face or other muscles. I still get this, and it used to be in my face a lot more, but I still get muscles that I'll just be like laying in bed, watching TV, doing whatever, and a random muscle anywhere on my body will just start like twitching as if it had like an electric signal going through it, right? It could be my bicep or my quadricep or hamstring or like one of my fingers, or when it's in your face, when it was in my face a lot, it would be like my eyelids would be like, I can't even explain it. It was so weird. My lip would do it a lot too. Headaches are big, and they're like horribly intense headaches. Neck cracks or neck stiffness, tingling, numbness, or a burning or stabbing sensation. A lot of people with this will be told they have fibromyalgia. We have facial paralysis, and that's what we call Bell's palsy, and it's usually affecting like half of your face. So one half of your face is going to be kind of like droopy, like your mouth on one half, your eye. If you try to like drink something, some of that water might just like come out the other side of your mouth. Eyes are blurry. You could have double vision. This was a scary one that I had when I just I'd be walking around, just have double vision. Everything I would see, if I'm trying to look at something, having extreme difficulty, especially with reading. If you're trying to read a book, and the word is there like 2 or 3 times, and the word next to it is also there 2 or 3 times, overlapping each other and everything, that's going to be very difficult to read. I know I don't have to really explain that, but good luck with that. Extremely frustrating, and you don't know what it's from, so it's extremely frustrating. You're like, you think like, wow, I'm I'm falling apart. My body's like breaking down. What is going on? Maybe I'm gonna die. That's how I thought anyway. But that's not uncommon, because feelings of extreme doom are another thing, right? That's a weird symptom. Ears buzzing, ringing, or ear pain, increased motion sickness or vertigo. This actually, I'll say, is the first thing I noticed, right? I was delivering pizza one day, and I took an elevator in a hotel up to someone's room to give them pizza. And when I stepped off the elevator, guys, I have never had vertigo before. I had the most extreme vertigo that I could ever imagine. Like, I couldn't even describe the feeling. I mean, I finished that delivery, but it set off like all this other stuff to start happening. Like, that was the first thing that happened, and it made me nauseous. It made me want to throw up. It made me want to do nothing but lay down, not move, not open my eyes, nothing. Lightheadedness, poor balance, or difficulty walking. Definitely had all those. Tremors, confusion, or difficulty thinking. I had this big time. And when you have something like confusion and difficulty thinking, like, you're not really gonna know how to explain what's going on with you to a doctor, like explaining any of your other symptoms or how they could be connected, or you're not gonna really understand how to, like, maybe look things up on the computer and see what's going on, WebMD or your own diagnosis, or you're obviously not going to know what kind of doctor to see. If it gets bad enough, you're just going to go to the ER, tell them, like, something is definitely wrong with me. None of it makes any sense. I have no idea. I'm running out of hope. I need you guys to tell me something. Like, just help me out somehow. Difficulty with concentration or reading. Forgetfulness, poor short-term memory. Yeah, that's a big one too. Where your short-term memory is so bad. Like, if you've never experienced this, what happens from this in regards to your memory, I don't think anybody will ever be able to explain it to you in a way that you could understand. You can't. I'm stuttering here trying to explain to you. It's you won't remember something that happened 30 seconds ago, right? Like, you're not going to remember anyone's name. The forgetfulness is so extreme that it presents like a massive challenge for anything you do in life, right? If you don't know what you're doing or what you did 30 seconds ago, you're not going to know what to do next with, like, simple things like your morning routine or directions to work, or anything that involves some type of process, even if it's just like two or three steps, right? So that's a big thing. Disorientation, getting lost, going to wrong places. I'll talk about that. I just did a little bit. Difficulty with speech or writing, so you're going to slur your words a lot. You're going to not be able to think of words, right? You're going to be talking and looking for a word to explain something, and you will just lose like a very basic word, right? So if I was like, that shirt is blue, I'm looking at a blue shirt in the corner right now, I would think like that thing it's blue, or let's see, I got skateboards on my wall, right? Wow, those are some cool things on your wall, some nice art, but I can't think of the word skateboard. It makes no sense. Like, things that you shouldn't have to even like think coming up with. They're just gone out of your vocabulary. And later you'd be like, oh yeah, that's a skateboard, that's right. Mood swings, irritability, depression, like major depression from all this, because obviously like part of it is that you are not able to live normally, so that's depressing in itself, but also the way that the bacteria can affect your brain and your mental state, which we'll talk about in my video when I focus on neuroborreliosis. That'll be a separate video. I was just reading a good article on PubMed about it, and actually one of the doctors I see wrote that article back in 2020. I never knew about it, but someone showed that to me today, so I was checking that out. Very interesting stuff. Disturbed sleep, either too much, too little, or early awakening. For me, it is no sleep. Like, especially when I first got sick, I was up for like days at a time, couldn't sleep, didn't know what was going on. I even moved out of my house because I thought there was something maybe in my house that was like causing this, right? It was like unexplainable. I felt very wired, but at the same time, my body, like my whole body was very tired, very fatigued, but my mind couldn't shut off. So I lived in a hotel for a week, didn't really get much sleep there at all. You know, I'm feeling hopeless. I'm thinking like, dude, nobody's ever experienced what I'm going through ever. This is insane. I've never read anything about this, heard about this ever happening to anybody. It was horrible. And then a friend let me live out of their apartment for another week after that, because still couldn't figure out what was going on. I also, when I moved back into my house, scrubbed out like my whole living area and threw out a bunch of crap that I thought maybe could be affecting me or making me sick or something. Like, just insanely bizarre stuff. Exaggerated symptoms or worse hangover from alcohol. When I think about it, maybe that was one of my first symptoms. You know, I'm 23, 24, go out, have 5 or 6 beers, whatever, not a big deal. But then the next day, I would be hungover until like 6 or 7 o'clock at night, right? Like, very, very, very high, very unusual hangover response, because, you know, like a couple months before that, go out and drink like 12 beers in a night, wake up, feel fine, you know? So maybe that was the first thing, but I didn't really understand it. I was just like, well, I guess I'm getting old and I can't handle alcohol anymore, and I'm like 23 or 24. So that didn't make any sense, but that was probably the initial thing before I really started going downhill. Okay. So I read you the Horowitz checklist. There's plenty more that aren't on there that are symptoms, but that's not important right now. So because of all these symptoms that are like very wide ranging, this disease will mimic many other diseases, okay? So if that happens, it's going to be harder to diagnose and treat you properly, right? Because the doctor could see one thing and be like, oh, that's this, or oh, you have depression, oh, you have anxiety, oh, you're having ear problems, you're having vision problems, you know, I'll send you to an eye doctor or whatever, anything. They're going to miss the actual diagnosis, and therefore they're going to miss starting treatment on time. And that is a big, big problem, because the later you wait to treat this, the more it's going to proliferate in your body and get deeper into your tissue and be much harder to eradicate. And there's a great reason for that, because of the way the bacteria is shaped, okay? So this bacteria is what's known as a spirochete. There are a couple other spirochetal illnesses. One of them is syphilis. Another one is leptospirosis. And so, for instance, in Lyme disease, this spirochetal illness, the bacteria is shaped like a corkscrew. So bacteria shaped like a corkscrew can find tissue and just burrow in super, super effectively, get in there super deep, make it very hard for antibiotics to penetrate that tissue and eradicate. And because of that, it's going to create massive inflammation wherever it's burrowing, wherever in your body that's doing that. And that inflammation is going to really be the cause of like a lot of the symptoms that come from this. So depending on where in your body it's doing that, you're going to have symptoms. Now a doctor will look at those symptoms and think that symptom is the disease. No, wrong. So yeah, very important to catch it and treat it early. The longer it goes, the worse the symptoms will become, and not only the worse the symptoms that you already have will be worse, but new ones will start popping up, and there's essentially no lack of symptoms that this disease can cause. So eventually you will have so many symptoms that you'll even start forgetting about ones you're dealing with every day, because you'll have so many other ones that are more debilitating and taking up your thinking, you know, what's left of your thought process, because like I said, forgetfulness, confusion, and short-term memory is also like extremely impaired during all this. So it's very, very scary. Now, I explained the spirochete will have a corkscrew shape, but that's not its only shape. It is such a good, it's horrible, but it's such a good bacteria at evading the immune response and antibiotics, because it can shift shapes. So it can shift into a like cystic form that is very hard for any antibiotics to penetrate and kill. And it can do that like essentially whenever it wants to, if it feels threatened by the immune system or medicine. What it'll also do is cover itself in what's called a biofilm. So a biofilm is just like layers of like mucus and other crap that it's, you know, putting off to surround itself to protect it from your immune system, from antibiotics. It's another way it can evade these things. And other tick-borne infections do the same thing. They make biofilms around themselves too. And when all of these get together and they're all making their own biofilms, now you get one giant nest of fibrin of these biofilms that's just like so layered together and like woven in and out of itself in such a complex shape, form, whatever you want to call it, that it's going to take so long for any kind of medicine to ever get through that. And most times, if it's protected itself enough, medicine won't get through that. That's when you'll need like certain enzymes to break down these plaques and layers of fiber in your body, fibrin, I should say, these layers of fibrin in your body, so that the medicine can actually get to the germs, right? But those germs are constantly building these biofilm layers around them and just making a big nest of this stuff. And inside that nest, they are reproducing more and more and more. And if you have Lyme, you also have probably several other of these diseases. So they're all just kind of in this big party, right? Where they're just getting bigger and stronger and bigger and stronger and protect themselves more and more and more. So that's, I guess I got one more thing to say. I'm going to talk briefly about what a Herxheimer reaction is. I'll do a whole series of videos on this because this whole concept is wild too. A Herxheimer reaction happens when you introduce medicine to kill off this bacteria, and it happens a lot in spirochetal illnesses like syphilis and Lyme. Syphilis is how it was first discovered. When they were treating patients and they were healing, the body would go through this rapid, intense detox that was way too much for the body's own detoxification systems. So the patient will get even sicker, like way sicker, before the body could catch up with, you know, excreting everything out and getting you well again. So that happens in Lyme disease too. So a lot of times when people are healing from this disease, they often feel absolutely terrible. You'll have to go through phases in this illness where you feel much worse than even just dealing with the illness, right? So a lot of people will be going through that and think maybe the medicine's not working or it's actually working against them, which is wrong. The medicine's doing exactly what it's designed to do. Your body just was not built to handle this kind of infection, and you weren't given a detoxification system that can act fast enough when all this crap is trying to be expelled. So you get very sick even when you're healing this disease. And of course, the different tick-borne infections have different types of Herxheimer reactions, and these different types of Herxheimer reactions are going to elevate different symptoms of that illness to a degree that, like I said, can be worse than the illness. So it's very difficult for people to get through these illnesses and with any hope or, you know, kind of positive outlook, which you need to get through them. As you're dealing with all this stuff, it just seems more and more hopeless and much scarier, and you know, you'll go through things that you didn't even go through in your original sickness just to get well again. So that's another unique aspect of this. You can get Herxheimer reactions from some other bacteria and parasites, but these spirochetal illnesses are the main causes of this type of reaction, I would say. So next video, I think I'll talk more about neuroborreliosis, because the pathology of Borrelia, when it gets into your central nervous system, is going to cause all these types of neuropsychiatric problems that I didn't really mention in any of this video. We'll get into that, and doctors will see those and confuse it with a patient that is presenting like a normal, I shouldn't say normal, but a psychiatric condition that they'll need to medicate, right? And this leads to medication of something that needs to be solved another way. But if they medicate for this, what's going to happen is that patient's probably going to need to, they'll take whatever they're given, and over their lifetime, they're going to need to take more and more and more and more, because they're not dealing with the root issue. So it's never getting better. It's only getting worse and worse and worse and worse. Their psychiatric symptoms never going to improve. And of course, taking high doses of these medications leads to other diseases and areas of unwellness. So that's a whole other thing in itself. This is all very, very deep, and it's probably really confusing if you've never heard about any of this stuff, but it's something we got to talk about, because it's been going on for a long time. No one's giving any kind of thought to it, or really any awareness in the way that I think it deserves. So we'll keep going. I'll see you guys in the next video. Take it easy.